I'm Dr. Dighton of Loughton Clinic, Cardiac Centre, and I want to tell you about echocardiograms. Echo because we're using sound which bounces back, and cardiogram meaning the heart and the images taken from inside the heart. This is an echocardiograph machine, and this is a still picture of the heart with the chambers, 4 chambers of the heart. I will show you what happens when it moves, because it's far more interesting when it moves. And you can see the actual heart beating. There you can see the heart actually contracting. So, here it is contracting. This is a valve moving. And you can see that with the centimetres down this side as a measure, you can actually get a measure of all the various chambers that are in the heart. Now, the echocardiogram is most useful for deciding whether there's actual heart disease. One of the reasons why we do this is to assess high blood pressure. High blood pressure causes a thickening of the heart muscle, and you can see really how bad high blood pressure has been in the past by seeing how thick the heart muscle is. The reverse may also be true, that is, that if you inherit thickened heart muscle, you may also get high blood pressure from it, and that does occur in a few cases. When I was a young doctor, we had lots of rheumatic heart disease. People that had rheumatic fever got thickened valves, and those valves became narrowed, something we call stenosis, and some became leaky, incompetent, and these caused the heart to get bigger and bigger. These days we see very little of this in patients that are born and bred in this country. If you see patients from third world countries, then it's far more common. So, for all intents and purposes, it doesn't exist anymore for us. However, there are a few rare diseases of heart muscle, such as cardiomyopathy. This is a truly abnormal form of heart muscle, which can cause heart failure and death, sudden death in athletes and so on. Heart failure is the other entity. We get older people whose heart becomes weak, becomes dilated and unable to contract. And with a machine like this, we can see how much oomph or contraction there is in the heart. So that's echocardiography, one of the basic tests now for heart function. We are doing it more and more in so-called normal people, just to see what's there. And I'm interested to have found over the last couple of years we're seeing far more abnormalities than I ever would have expected. So we're now trying to introduce this into our routine screening for the heart, where we do it both before and after exercise. So echocardiography, a very good test of the heart. You can actually see the heart moving, not for everybody, but if you've got high blood pressure and a suspicion that you might have something wrong with it, this is an essential test.